Good afternoon, everybody. My name is Nicholas. I'm a peer educator with Argus Community. Today, we're going to talk about women's health, HIV, and STIs. Let me introduce you to the team. Like I mentioned, my name is Nicholas. I'm a health educator. Also, today, we're going to have Ms. Stacy Britton, who's a health educator, Mr. Sean Belgrave, who's our behind-the-scenes technical coordinator. Without him, you wouldn't be seeing our lovely faces today. We also have a couple more members of our team, Mrs. Loletta Brown, who's a health educator, and Christopher Owen, who is our behavioral health coordinator. And with that, we're going to start our presentation, and I'm going to pass it to Ms. Loletta Brown.
So good afternoon, everyone. I'm Loletta Brown. As Nicholas mentioned, I'm a health educator with the CATCH program. And I'm going to talk about HIV, AIDS, and how it affects women. First of all, HIV is a virus that causes AIDS. It's passed through body fluids such as blood, semen, vaginal fluids, and breast milk. It is important for pregnant women to be checked for STIs. They can cause women to go into labor too early and may complicate delivery. STIs effects on babies can include stillbirth, low birth rate, neurological problems, blindness, liver disease, and serious infections. But there are treatments to minimize these risks. Treatment during pregnancy can cure STIs and lower the risk of passing infection to the body. You know, throughout the world, HIV is often spread through sex. Women may be greater risk of being infected with HIV through sexual intercourse than men. And that's because women have fragile tissues in the vagina that can tear slightly during sex, and that way it lets the virus into the body. HIV may cause changes in your period. HIV may cause changes in your period because of the way the virus affects your immune system, which is the virus defense system. And that's one of the differences of how, between men and women, how the virus affects women. The virus can change your immune system and can affect your hormones like estrogen and progesterone. These hormones control your period. Progesterone and a female sex hormone, and it is crucial, and it's a crucial part of the menstrual cycle and maintenance of pregnancy. HIV may cause some health problems that are unique to women, such as gynecological issues, such as increase of cervical cancer, increased risk of heart disease, HIV medicine side effects, and dual medications, such as HIV medication works as well for women as for men. But however, some medications in women can cause different side effects than men. Like, for example, nevirapine. Side effects with that medication, studies have linked the HIV medication nevirapine to a higher risk of rashes and liver problems for women than in men. I'm having problems with this word. Ritonavir. The side effects with ritonavir medication, also called Norvir or RTV, these medications may cause nausea in women and vomiting. It is also sometimes prescribed to help medicines work better with women. Also, one of the other effects is early aging and menopause and osteoporosis. Birth control and HIV in women with HIV can safely use birth control to prevent pregnancy. There are some HIV medications that may interfere with HIV medications, so make sure you are speaking to your healthcare provider to get the best control, to get the best medications controlled for you. To prevent the spread of STIs such as gonorrhea and syphilis, make sure to use a condom. Next, Sean. What is HIV? Human immunodeficiency virus. Next, Sean. Okay, human immunodeficiency virus, it attacks our white blood cells, CD4 T cells, which are our fighter cells that help us fight the infection. HIV seeks out white blood cells and then attaches itself to it, then penetrates our healthy cells, integrates with the nucleus of the healthy cell and replicates and makes new copies of HIV and destroys our healthy white blood cells. One HIV cell can contaminate or destroy 10,000 healthy cells. Next, Sean. Okay, how HIV is transmitted. One, unprotected sex, anal, vaginal, oral, with an infected partner, or IV drug use, sharing needles, syringes, works, etc. That may mean the water or the cotton or the cooker, whatever, or the spoon, whatever you're using to mix the drugs in. That can transmit HIV. Mother to child, in the womb, during birth, and breastfeeding. How HIV is not transmitted. It's not transmitted from touching or hugging or tears or sweat, kissing. There's not enough HIV in saliva for transmission to occur. So you can't get it from kissing or from sitting on toilet seats or from insects or pets or from air or water. These are the ways that HIV is not transmitted. Next, Sean. Okay, body fluids. High risk for body fluids is blood, semen, which is pre-cum, vaginal fluids, anal secretions, amniotic fluid, the water baby is born in, and fluids around body parts in your joints. And the low risk, as mentioned before, saliva, sweat, tears, mucus, which is snot, your feces, urine, pus, or vomit. These are all low-risk fluids unless combined with a high-risk fluid. And with that being said, I'll turn this over to Nick.
Thanks, Loretta. As Loretta just went over HIV, we're going to talk about what is AIDS. AIDS is an acronym that stands for Acquired Immune Deficiency Syndrome. So, how do you get an AIDS diagnosis? Well, the average human being has in between 800 to 1,200 healthy white blood cells per milliliter of blood. If that number falls below 200, a person will be diagnosed as having AIDS. Another way of being diagnosed as having AIDS is if your white blood cell count gets to 350 and you also develop an opportunist infection. Some examples of opportunistic infections are PCP pneumonia, Kaposi sarcoma, shingles, yeast infections, and cervical cancers. So, what is the difference between HIV and AIDS? As Loretta mentioned, HIV is a virus, human immunodeficiency virus. AIDS is the diagnosis, acquired immunodeficiency syndrome, a collection of things. So how do I protect myself from contracting HIV? Abstinence. Use condoms the right way every time you have sex. Remember, condoms have expiration date, so you want to make sure that it's not expired so the latex doesn't get weakened. Get tested and treated for other STIs. Having other STIs increases your risk of contracting or transmitting HIV. You might want to consider taking PrEP or PEP, which is pre-exposure prophylaxis, or post-exposure prophylaxis. We'll get into that in a little bit. And don't share needles. Let's talk about abstinence. That's the number one way of preventing pregnancy and infection, when all sexual contact is avoided, including vaginal, oral, or anal. Then we also have partial abstinence, which is restraining oneself from indulging in sexual activity partially, not engaging in intercourse. So why use a condom? Why not use a condom? Well, when used consistently and correctly, condoms are highly effective in preventing HIV. Condoms are effective at preventing sexually transmitted infections that are transmitted through body fluids. Dental dams are very effective as well if used properly. Dental dams could be used for cunnilingus and analingus. Let's talk about the male condom. The male condom keeps seminal fluid, cum, or pre-cum from entering the partner's body during oral, anal, or vaginal sex. The types of materials that are used for condoms are latex, which provide the best protection against HIV. However, there are people that are allergic to latex condoms. So then we have polyurethane, which are plastic, synthetic rubber. They're good options for people with latex allergies, like I mentioned. There's also natural membrane condoms, such as lambskins. These do not protect well against HIV and certain STIs. They are usually only effective against pregnancy, meaning that infection can pass through them. Insertive condoms. Insertive condoms are either placed in a female's vagina or anal, or a man's anus. It's a thin pouch worn inside the insertive partner to prevent seminal fluid, cum or pre-cum, from entering the body during intercourse. It has a ring on each end. This ring holds the condom in place. The outer ring stays outside, so it covers the orifice. It's made of rubber-like substance called nitrile. It's just as effective as male condoms at preventing STIs, HIV, and pregnancy. We do not know how well female condoms prevent HIV and other STIs when used for anal sex. However, we do know that HIV cannot travel through this nitrile barrier if used correctly. Safe to use either with water-based or oil-based lubricants. So, speaking about lubricants, let's go into lubricants a little bit. Lubricants help to prevent condoms from breaking. There's three types of lubricants. We have your water-based, which are the best, silicone-based, which are also good, and they're both okay to use with latex condoms. However, oil-based lubricants, such as petroleum jellies, shortening mineral oil, massage oils, body lotions, cooking oil, should not be used with latex condoms because they can weaken latex and cause breakage, basically breaking the condom down. PrEP, like I mentioned earlier, PrEP is pre-exposure prophylaxis. There's several different types out there right now. One of them is Truvada that help prevent HIV transmission. Who uses PrEP? You have to be HIV negative. People that have partners that are HIV positive. People that don't like to use condoms. People that have sex with sex workers or multiple partners. There's a 2-2-1 method of taking Truvada. You take two pills the day before the encounter, one of the encounter, and one after the encounter. And there's PEP, which is post-exposure, meaning you got exposed to HIV and you have to go the next day to a clinic or a doctor and explain the situation that you believe that you're exposed to HIV, and they'll give you PEP, which is also Truvada and a couple other medication that they're using right now. And this is used after exposure to HIV. It's most effective if it's taken 24 to 72 hours after exposure. You means you. You means you is an informational campaign that stands for undetectable equals untransmittable. This campaign is here to educate the public about the effectiveness of consistently taking HIV medication and stopping the spread of HIV through sexual transmission. This means that if a person is undetectable in their viral load for 6 consecutive months, and he can have normal sexual relationships with his or her partner. Next. And with that, I'm going to turn this presentation over to my coworker, Mrs. Stacy Britton, who's going to talk about women's health and various STIs.
Thanks, Nicholas. So let's see what we have here. Come on, Sean. What are STIs? What types are there? So you've heard us use the term STI throughout the presentation. STIs are simply sexually transmitted diseases. Somebody sat down, thought about what disease sounds like, and we switched that up to STIs, sexually transmitted infections, because they don't always lead to disease. So sexually transmitted diseases are passed through vaginal, anal, or oral sex contact. Female symptoms of an STI can include vaginal itching, rashes, unusual discharge, infection, display no symptoms at all. So there are times that folks may be concerned about a discharge, and you have to remember that the woman's body is very peculiar. And so there are natural bacteria and there are unhealthy bacteria. And sometimes discharge is normal. So what you're looking for when you're concerned about a discharge, you're looking for odor or maybe even discoloration. Some STIs include chlamydia, gonorrhea, syphilis, herpes, and trichomoniasis, HIV and AIDS, and HPV. Chlamydia is the most commonly reported STD in the United States. It's spread mostly by vaginal and anal sex, but you can get it through oral sex too. Sometimes you'll notice an odd discharge from your vagina or penis, or pain or burning when you urinate. But only about 25% of women will contract chlamydia. Gonorrhea is another common bacterial STD. People often get it with chlamydia, and the symptoms are similar. Unusual discharge, remember we're looking for odor or discoloration from the vagina or penis, or pain and burning when you urinate. Most men with gonorrhea get symptoms, but only about 20% of women do. Gonorrhea is easily treated with antibiotics, so don't be ashamed, don't be embarrassed. Go and speak with your healthcare provider. Let them know what's going on with you so that you can get the treatment. I believe somewhere in this slide, we're going to talk about what happens when these things go untreated. Okay, so we're going to look at the next slide. So, bacterial infections. We have some stats from 2018 that are going to give some comparisons between the world, the United States, and then New York State. Numbers are pretty high. So recorded cases of chlamydia throughout the world are up to 127 million. In the United States, it's only 1.7 million. And in New York State alone, it's 119,571 reported cases. Reported cases for gonorrhea are 87 million throughout the world, 580,000 throughout the United States, 37,262 in New York State alone. And with syphilis, we're looking at 6.3 million reported cases worldwide, 115,000 cases reported in the United States, and 2,654 cases in New York State. So some viral infections include genital herpes, HIV AIDS, genital warts, HPV, human papillomavirus, or HCV, hepatitis C virus. Other types of infections are considered as parasitic: Trichomoniasis, scabies, and crabs. And so with these infections, you might see little bugs in your vaginal area. Scabies causes a huge breakout over the skin and can spread across the body. It's very painful. Crabs will have you needing to shave. You will need a special shampoo, and you will also need a doctor to ensure that eggs have not been hatched anywhere else, which include the anus area. All right. Trichomoniasis is also a very painful infection. And so do not ignore if you see something that might look like dandruff, or you find a little pebble or something and you're not sure what it is, but it's kind of soft. This would be a parasitic infection. How do we prevent STIs? Well, like Nicholas mentioned, abstinence is one of the #1 ways to prevent any sexually transmitted infections, unwanted pregnancies, and so on. However, safe sex means using condoms. Again, Nicholas mentioned checking condoms for expiration dates, which a lot of folks do not do. Keeping condoms stored properly, not in a wallet where there's heat and friction going on, and not reusing condoms, right? These are very important ways to use condoms properly. Most STIs, such as syphilis, gonorrhea, chlamydia, trichomoniasis, are treatable and curable. However, herpes, hepatitis B, HIV and AIDS, HPV are treatable, but they're not curable. So it's very important, if we're thinking about prevention, to consider abstinence or using condoms consistently. Chlamydia, as we mentioned, is one of the #1 sexually transmitted infections amongst men and women. It's caused by a bacteria. It is spread through sex. Women's symptoms include abnormal vaginal discharge, which we talked about, burning during urination or urgency to urinate, bleeding in between menstrual cycles. It could be light, it could be heavy, it could be spotting, but if that's happening in between your cycle, this is something that you might want to be concerned about. Although most women do not experience any symptoms. So usually I would say look out for that discharge or an unfamiliar smell to what you're normally used to with your body. Symptoms in men include pain during urination, abnormal discharge from the penis, and also, folks, you can get abdominal pains as well. If left untreated in men and women, chlamydia can infect the urinary tract and potentially lead to pelvic inflammatory disease, otherwise known as PID. Herpes, very, 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 very common. And herpes is, again, something that we can treat but cannot be cured. It's caused by infection with herpes simplex virus. There are two types of herpes. So there's herpes simplex 1 and herpes simplex 2. Herpes simplex 1 is typically acquired orally and causes cold sores. Sometimes you'll see a cold sore on the outer part of a person's lip. Sometimes you may not see it, and it'll be on the inner part of a person's lip. Herpes simplex 2 is acquired by sexual contact affecting the genital areas. Either strand may affect either site. That depends on your activity. Some people are asymptomatic or have very mild symptoms. What this means is that they've been infected, they're not having any outbreaks, they're not having any discomfort, therefore they don't know they have herpes, okay? However, they can pass this sexually transmitted infection on to others. Those that do experience symptoms usually notice them 2 to 20 days after exposure, which lasts 2 to 4 weeks. Again, we're talking about the woman's body here. And so I need everyone to be very clear about what happens with our bodies. By the time we see symptoms or feel any discomfort, we've been infected for a period of time. And so it's very important that by the time we encounter any burning or any irritation of any sort, that we need to seek medical help at that time. Symptoms can include small fluid-filled blisters, headaches, backaches, itching or tingling sensations in the genital area or anal area, pain during urination, flu-like symptoms, swollen glands, or fever. We have to be very mindful that because our bodies are so tricky, that no matter what we're feeling, if it's an off time, that we have that checked out. So many different sexually transmitted infections mimic the flu or a cold. And so this is very important. Herpes is spread through skin-to-skin contact with a person infected with the virus. The virus affects the areas where it entered the body. The virus is most infectious during times when there are visible symptoms. Those who are asymptomatic can still spread the virus through skin-to-skin contact. So as Nicholas mentioned earlier in regards to condom use, when you're using an inner condom, also known as female condoms, and they have the 2 rings on the end, one ring is for insertion and the other ring is to cover the outer orifice. And so this gives us another barrier of protection for that skin-to-skin contact. So these condoms are very effective in minimizing the spread of this particular sexually transmitted infection. Gonorrhea, another bacteria that lives on most mucous membranes in the urethra, vagina, rectum, mouth, throat, and eyes. Untreated gonorrhea can be a very vicious infection. It can spread through contact with the penis, vagina, mouth, or anus. Symptoms of gonorrhea usually appear 2 to 5 days after contact. Symptoms in men include that burning and pain while urinating, increased urination frequency, discharge from the penis, white, green, or yellow. Now this is very specific now. It's like I spoke to you before about chlamydia. When you're looking at a discharge, you have to know your body. Sometimes folks have a clear discharge, which is safe. But once you start seeing color, then this is something that you want to make sure you contact your health professional and be treated for. You'll see red or swollen urethra, swollen or tender testicles, or sore throat. That usually occurs if you're engaging in oral sex, and the back of our throat is very vulnerable, okay? Symptoms in women may include vaginal discharge, burning or itching while urinating, painful sexual intercourse, severe pain in lower abdomen. If infection spread to the fallopian tube, or it can also cause people to have miscarriages. The virus itself can also be transmitted from mother to child. And so if mom is feeling anything going on, as what I just mentioned, then she should get in touch with her gynecologist immediately, okay? Many women do not show symptoms, but there are antibiotic-resistant strands for gonorrhea. Most cases can be cured with antibiotics. Syphilis, caused by bacteria. Untreated, it can lead to complications and death. So we went from complications to death. So let's just talk a little bit about syphilis and what syphilis can do. Syphilis can irritate, can cause blindness. It can cause brain damage. It can travel and cause paralysis. And as time goes on, untreated, result in death. Manifestations of syphilis include the ulceration of the urogenital tract, mouth or rectum. If left untreated, the symptoms only worsen. I'm sure some of you may have seen pictures of various sexually transmitted infections in their very advanced stages. If they go too far untreated, then there's no treatment and people are left to suffer. Trichomoniasis. We said that this was a parasite. So this is caused by infection with a protozoan parasite called Trichomoniasis vaginalis. It affects both men and women. Symptoms are more common in women. Most patients are treated with an antibiotic called metronidazole, which is very effective, and I don't think I said that right. But if you see your healthcare professional, you will be treated with antibiotics, and as long as that person knows what he or she is prescribing, then you're in safe ground. Okay, and so vaccines. Vaccines are available that protect against viral sexually transmitted infections such as hepatitis A and hepatitis B, and some types of HPV, human papillomavirus. Vaccinations before initiation of sexual contact is advised to assure maximal protection. And so these vaccines are usually administered when we're young. Those of you who are parents and your child is being vaccinated, these are the vaccines that they're getting to ensure that as they get older, that they have gotten that protection in advance. The hepatitis A and B vaccine is a 3-series injection that we get when we're young, and we get one injection and then we go back a month later, and then I believe it's 3 to 6 months later, we go back for that last shot. The HPV vaccine is very important because this can prevent future issues such as cervical cancers and other cancers. There's not just cervical, but since we're talking about the woman's body, I'm just going to highlight cervical cancer at this particular time. Okay, Sean. HPV, the human papillomavirus. Nearly every sexually active person will have HPV at some point. It's the most common sexually transmitted infection in the United States, and more than 40 types of HPV can be spread sexually. You can get them through vaginal, anal, or oral sex. You can get them by skin-to-skin contact as well. Most types of HPV have no symptoms and cause no harm, and our body actually gets rid of it on its own within about a 2-year period. But some of them cause genital warts. Others infect the mouth and throat. Still others can cause cancers of the cervix, the penis, the mouth, and the throat. There are 3 vaccines that are available now that protect against these cancers. Gardasil and Gardasil 9 also protect against genital warts, vaginal cancer, and anal cancer. The CDC is very reliable. They recommend that young women ages 11 to 26 and young men ages 11 to 21 get vaccinated. However, a child can be vaccinated as early as 9 years old. A pap smear can show most cervical cancers caused by HPV early on. Early detection is key, so keep those appointments for your pap smears and speak with your gynecologist if you have any concerns. A little more about HPV, folks. If a woman is infected with a type of HPV that can lead to cancer, the doctor may suggest frequent pap tests to watch for signs of abnormal cell changes in the genital area. So a doctor usually would suggest that you come and meet with him or her 3 to 6 months, every 3 to 6 months, just to see what's going on and to monitor any growths. Abnormal cell changes in the cervix are a warning sign of possible cervical cancer. The doctor may also do a test called coloscopy. I don't know why that's so difficult to say because I recommend people have them done regularly, right? In which a special magnifying device is used to look closely at the cervix and the vagina and vulva. The HPV virus itself cannot be treated, but often the body will clear HPV infection on its own. In most women, cervical HPV infection clears itself on its own within 2 years of detection. If the HPV infection has caused abnormal cell changes that could lead to a cervical cancer, there are 4 main treatment options. The first is watch and wait. Okay, and sometimes the cells change, and it's called dysplasia. And this is a precancerous cell. Or cervical, I don't know why I tried to say this word, okay, will heal on their own. I'll have you guys next time. Cryotherapy. This involves freezing the abnormal cells with liquid nitrogen. And what happens is when the cell is frozen, it's not allowed to continue to grow. All right, and then the next procedure is also known as a cone biopsy, which is a process in when they remove the abnormal areas. Usually biopsies are taken just to see if they may be cancerous or not. And then there's also laser therapy. Laser therapy uses a light to burn away abnormal cells. A loop of electrosurgical excisions procedure. It's called LEAP. The abnormal cells are removed with electrical currents. And usually it's either a laser that focuses on the cell, or it'll have a loop on the end that will focus on the cell, and then it's scraped off with the electrical currents. Okay, Sean. What can you do to prevent HPV? Well, your doctor may want to keep monitoring you and make you get tested 3 times a year, as well as a pap test. Use condoms, of course. After and before you start having sex with a new partner, make sure you get tested, because plenty of people don't know they have it or are infected. Advocate for yourself. Only you can worry about you and your body, so get tested. If you notice any abnormalities, anything that you're not used to in your body, because our bodies are all different and unique to us, then these are things that you bring up and speak with your doctor about. And before I introduce you to Chris, who's not here, I'm going to add that you should keep, I suggest everyone keep a medical journal, so when things start changing, you can document them. Sometimes we may be feeling a certain way, and by the time we get to the doctor, we've forgotten what we wanted to mention, or we've forgotten the concern. And so write them down, so that way when you meet with your healthcare provider, you can assure yourself that you will not forget anything, okay?
Stacy, do you want me to finish it up? You need a break, or you got it?
Oh, I'm good.
Okay.
Thanks. And so the gentleman's face on the screen is our behavioral health coordinator. This is Christopher Olin, and Christopher has a huge job with us. He assists folks with treatment. So if anyone is in need of HIV testing or services, hepatitis C testing or services for treatment, Christopher is available to make those types of referrals. He can also assist folks in making referrals for mental health and substance abuse services. He has a list of local food pantries for those who are in need. And he can also assist those who are uninsured obtain medical insurance. So his name is Christopher Olin. His number is here on the screen, and you can reach him at colin@arguscommunity.org. HIV and Age Resources. So Argus Community, EIS, Early Intervention Services, and our CATCH team. CATCH is our community action to combat HIV and hepatitis C. You can contact us for any resources you may have, any questions you may have. Our numbers are here listed. The number for our director and supervising coordinator are also, our emails are also listed for them. Whatever you contact us about and discuss with us is confidential. We have a no judgment-free policy, or I should say a judgment-free policy, right? Ask any questions that you have. If we're not able to answer those questions, then we definitely can refer you for services where you will be able to have your questions answered. We offer pre and post-test counseling. We also have access for testing of any other sexually transmitted infections that you may be concerned about. We also provide male and female, also known as inner condoms, and we can provide you with referrals for PrEP and PEP. All right, at the bottom is the AIDS hotline. So if you or someone you know requires services, go ahead and call them at 800-541-AIDS. Again, CATCH program offers free remote testing. What does this mean? This means that you can get a free at-home HIV testing kit. Again, CATCH means community action to combat HIV and hepatitis C. So you would contact us at the number or the email on the side, and a kit will be sent to your home. You can test yourself in private. You will also be asked to complete a survey. Once that survey is completed and sent in, you will receive a CVS gift card valued up to $25. So again, I want to thank you guys for joining us. If you have any questions, any comments, any concerns about any of the information that was provided, you can always contact us at our 929-322-4106. But you can also email us at arguscatch@gmail.com. And please feel free to follow us at Argus Catch on Facebook, Argus Catch NYC on Instagram, and at Argus Catch on Twitter. Thanks.